Hey, hi everyone. Thank you for joining us on World Mental Health Day, an important time to shine a light on mental wellness and the care we all deserve. We're so glad you're here for today's session on mental health in times of catastrophe and emergencies, a very important and timely topic. Before we dive in, just a quick note on how today will go. Your camera and microphone are off, so sit back and relax. If you have questions or comments during the session, feel free to drop them in the Q&A box and we'll go over them at the end. If anything isn't working, sound, video, etc., let us know in the Q&A or email marketing@communitycare.com. After today, if you'd like to learn more or have any follow-up questions, just email us at marketing@communitycare.com and we'll be happy to help. So let's get into it. At Community Care, we're proud to offer something really special, behavioral health care built right into our primary care and specialty practices. That means your mental and physical health are treated together by a team that works closely to support your overall well-being. It's better for patients and better for our providers too, and you'll hear why from our team today. We're excited to introduce a few of the amazing people behind this work. Dr. Cindy Stone is the creator and director of our integrated behavioral health program. She's passionate about each patient getting the care they need when they need it. And this is precisely what integrated behavioral health stands for: removing barriers to care, reducing stigma, decreasing wait times, normalizing mental health conversations, and treating the whole person. Madison Akins-Rock is the lead of our social media team, and Jenna Gazzillo is one of our lead supervisors. Both are licensed mental health counselors at our practice. They work side by side with patients and providers every day to support the behavioral health component of whole person wellness. We are so excited to share this with you, so let's get started. I'll now turn it over to Dr. Stone.
Thanks, Alicia. That was a great intro. We really appreciate it. And we're super excited to be here today to celebrate World Mental Health Awareness Day this October. The theme for this year is mental health in times of catastrophe and emergency and how this affects us all. So this is a really big, it's a big theme. There's a lot that goes into this, and it's a really special theme for this particular day. And we really want to dive into this with a lot of things about catastrophes and emergencies, but also some really practical information for everybody. So in today's session, what we'll be exploring is the current state of global mental health, how catastrophes and emergencies affect mental well-being, what vicarious trauma is and who it impacts, how to recognize those directly affected by crises and those indirectly affected, and what we can all do as individuals, workplaces, and communities. And this is where a lot of the practical tips are going to come in that we hope will really benefit everybody that's in this webinar. So next slide. And today we're going to first start off with the current state of global mental health. And I'm going to turn that over to Jenna.
Okay, so let's talk global mental health by the numbers. So a lot of the statistics are pretty eye-opening. So in 2005, the World Health Organization reported that more than 1 billion people worldwide are living with mental health disorders. In 2021, about 13.9% of the world's population was estimated to experience mental health disorders. So globally, anxiety disorder burden is such that 71% of it could be avoided if all of these with anxiety had access to optimal treatment. Only less than 30% of people with depression globally receive minimally adequate treatment. And worldwide, only 29% of people with psychosis receive mental health services. So in global burden of disease research, mental disorders accounted for a significant proportion of disability-adjusted life years, ranking among the top causes of disability worldwide. So across low and middle income countries, more than 75% of people who need care do not receive it. It's quite a huge treatment gap. So lastly, but there's a lot of statistics that are pretty eye-opening. The delay to treatment is substantial. So there's about a 5-year lag between onset of symptoms and receiving adequate treatment.
Yeah, and these are really important stats. Jenna
Mhm.
did a great job of kind of outlining them for us. And these are only some. We'd be here the whole webinar if we had,
Absolutely.
if we talked about them all. But they're important to know, but they're also important to realize there's a lot to be done.
Next slide. So now I'm going to turn it over to Madison to discuss mental health in times of catastrophe and emergencies.
So catastrophes and emergencies, they can take many different forms. Some are naturally occurring, some are man-made, some happen within society, but all end up leading to a lot of times significant disruption, loss, and of emotional impact to others, not only individuals, but also families and communities. The events themselves can be really impactful in the point where they can have immediate impacts to people within the times of catastrophe and disasters, but also have a lot of longer term effects as well in terms of mental health and well-being.
So we've also, we just mentioned access to these services. And so access to services, mental health and catastrophes and emergencies, going off the data that Jenna already presented, millions of people worldwide are affected and were affected by catastrophes and emergencies. Unfortunately, again, we've already heard that a lot of these people don't get the treatment that they need. In many conflict or disaster affected regions, it's estimated that 1 in 5 people develop a mental health condition during or after emergencies. Mental health disorders caused by disasters and emergencies require special skills, knowledge, and competencies of the professionals. And this is, here we're talking about a gap in treatment overall, but now we're talking about more of the specifics of that. So we know that a lot of people aren't getting mental health treatment that they need, but even more specifically, the treatment that they need a lot of times requires specialized skills on the part of mental health providers that are providing the care. And so that's really another gap that we have in kind of really addressing this whole problem. There are very large number of competent people out there, but we need a lot more. And that's just, this just goes without question. Another really important point on this is that we're going to dive into a lot more as we go forward in the webinar, but you don't have to be present to experience the consequences. So what that means is you don't have to be in the middle of the disaster or the catastrophe or the emergency to actually experience mental health concerns as a result of those.
So we're going to talk a little bit more about like the direct and the indirect impacts of these events. So directly affected individuals may experience trauma, grief, loss of livelihood, and long-term mental health conditions. Indirectly affected individuals, such as those displaced or separated from family, may suffer economic hardships, disruption of community bonds, chronic stress. And then, as Dr. Stone said, even those watching from afar, so those that are not present via like news or social media, may experience vicarious trauma, anxiety, and emotional fatigue as well. I'm going to turn it over to Madison now just to discuss more about vicarious trauma.
So vicarious trauma refers to the trauma that develops over time to an individual who's repeatedly exposed to a level of trauma. A lot of the times, trauma is that of others. So some individuals will experience vicarious trauma due to hearing about trauma through friends or family, the things that they have experienced. It might be through the news, as Jenna alluded to just a minute ago. It might be through even like different things like movies and really external sources. Although again, like Dr. Stone mentioned earlier, even if you're not the individual in the middle of the catastrophe or emergency, they can still have a really large impact on mental health and well-being overall.
So why this matters? I mean, I think you all are probably figuring that out already, but more specifically, this phenomenon leads to shifts in one's cognitive schemas, worldview, sense of safety, identity, and emotional regulation over time. Unlike acute stress, or secondary traumatic stress, which may arise from a more singular exposure, vicarious trauma tends to build gradually, as Madison was alluding to, and persistently, especially in the context of major global disasters and emergencies. Research shows that high frequency of media exposure, especially vivid imagery of human suffering, can provoke emotional and psychological responses, altering beliefs about safety and predictability of the world. So, all this is kind of key, but some of the things to really hone in on here is how these things affect not only people that are, directly impacted, but how they affect us all in our perception of the world and our perception of our worldview. You'll hear a lot of people, we've had a pandemic, we've had a lot of major tragedies in our country and in the world. And a lot of people will sometimes say, like, what next? They're just kind of waiting for the next ball to drop. So, it changes the way you think of the world. It changes people's way of how they kind of identify with the world. That it changes sometimes your own feeling of safety in the world and your own feeling of predictability, and how can you really feel safe and move forward in a day-to-day when you never know what's going to happen next. So these are all things that are really important, relating to trauma being directly or indirectly experienced.
Okay, so who can be affected? The short answer is anyone can experience vicarious trauma. Healthcare professionals, physicians, nurses, counselors, social workers, first responders, police, firefighters, EMTs, teachers, and school staff, family members or caregivers supporting a loved one that has gone through a traumatic experience, volunteers, humanitarian workers, people frequently exposed to distressing news or social media. And then really what we'll get into next is anyone with a high level of empathy or sensitivity. They're, extra in tune with some of the things that are going on in the world.
So we'll talk a little bit about the risk factors that might lead to vicarious trauma. Risk factors are the things taken into consideration that might increase the likelihood of an individual experiencing trauma. So these are individuals who are more empathetic or compassionate, who might have an own personal experience with trauma in their history or background, more of an individual experience that they've already endured. Those, like Jenna just mentioned, who are frequently exposed to distressing content, whether it be through the media, social media, the news, or even in their personal life. A lack of support, we know how important support is in our social networking and everything like that. So a lack of support can really make a big difference. Daily levels of stress and feeling overwhelmed on a consistent basis can also lead to high likelihood of trauma. And then, of course, poor self-care habits. So if there's not consistent, productive, and positive self-care habits that we have integrated into our day, those individuals are also more likely to be affected by vicarious trauma than others.
Absolutely. Risk factors are a really important part of this. So that was a great overview, Madison. Now we're going to really look at how to recognize vicarious trauma. We've talked about a lot of things related to it, but how do you know if you're actually experiencing this? So some of the key things are listed right on the screen. I'll review them. So emotional fatigue and exhaustion, heightened anxiety, feelings of unreality or detachment, difficulty concentrating, intrusive thoughts, change in worldview, which is what we've kind of already talked about, feelings of helplessness or sometimes hopelessness, avoidance behaviors, feeling like you're out of control, emotionally out of control, like your emotions are just kind of up and down all day long. And then there's somatic symptoms, things like headaches. A lot of times people don't attach that to stressors. So headaches is a big one. Sleep issues. I think we link that a lot to stressors, but sleep issues is another problem here. So there can be difficulty falling asleep, difficulty staying asleep, waking up too early, any of those things, excessive social media news consumption, and poor work performance. So, also a lot of people will say, well, I already had some anxiety, or I already had some of, I've already experienced some headaches. So, and that's common too, right? Because a lot of times we all have different things like this. But I think one of the things that's most important about really relating this to recognizing vicarious trauma is, let's say you have anxiety. Is it heightened? Is it a little worse than it is? Or let's say you always have some problems sleeping, but have they gotten worse? So really important, again, we've talked about this. We had a pandemic. We had things going on in the world all the time. We turn on the TV, and a lot of times when something traumatic happens, you turn on the TV or you go on social media, and it's just a constant flood of the same video or the same something over and over. You're watching a news program and it's a half an hour long, and you see the same exact, 10-second video over that's played like 20 times in the course of a half an hour. So it's things like that. That really kind of can really cause vicarious trauma on us. And so it's kind of just like a little checklist to keep, kind of heighten your self-awareness about, is this affecting me?
In both yourself and your loved ones and people you
Absolutely.
care for and your kids. So this is a great list to look out for, like Dr. Stone said. And, I'm sure there is a lot more symptoms that could be added to this as well.
Yeah, absolutely. I mean, this is like we said, just basically the main ones. But, even, add to that coworkers, really anybody you interact with. There's probably nobody in the world that's not affected by what we're all experiencing at this point in time.
I think it also really highlights how intertwined our mental and physical health are, right? So when we see those changes somatically, like physically, even changes in our basic need, like appetite and sleep and, our interest in doing things, those are really some big kind of like warning signs to keep an eye out for, and be able to recognize these early on and get some different supports into place.
Absolutely. Okay, now we're going to talk about, kind of hone in on what we said at the beginning. So here's a lot of facts. Here's a lot of things that we wanted to kind of just bring to the table. So what can we do about it? What's some specific supports and strategies that we can actually employ to help with this? First one we're going to talk about is really how to support our kids. So this is a really, really big topic for everybody that works with kids and parents and all of us. We want to talk about how parents can talk to their children, how medical providers, anybody that's really works with children, can talk to them about frightening events in age-appropriate and supportive ways. I'm going to turn it over to Jenna for that.
Okay, so according to the American Academy of Pediatrics, the APA, there are a few things that you have to both keep in mind and a few things that we can do just to help lessen the load on our children. So be age appropriate, of course. Share simple, honest explanations that fit the child's age and maturity and developmental level. Avoid unnecessary graphic details. Certain age groups should avoid the news entirely, and conversations with adults about these things. Start by listening. Ask what they've heard or seen and correct any misinformation gently. You definitely want to validate their feelings, acknowledge the fear and the sadness or confusion, reassure them that these feelings are normal. And part of normalizing it is, maybe expressing that you may also be feeling similarly. Provide reassurance. Emphasize that adults are working to keep them safe, whether that's parents, teachers, community helpers. Point out some people in their life that are there to keep them safe. Limit media exposure. This is super important. Protect children from repeated or graphic coverage, and co-view news with older children and discuss the topics together. Encourage questions. Let them know it's okay to ask again if they feel worried later. It's okay to kind of remind them that you have an open door policy, and any question, there's no bad questions, and any question they can come to you with. Model calm coping. So children learn by watching. Share your own healthy strategies with them, but also model these healthy strategies for them. If you're stressed out while watching the news, if you're stressed out by something happening, acknowledge that and say, oh, I'm going to take some deep breaths right now because I'm feeling overwhelmed. Deep breathing, taking breaks from news, family routines, that is all a great part of that.
Yeah, those are all really great, helpful tips, Jenna. And just to dive into a couple, like a little bit more, Jenna made such a great point with validating feelings and really talking to your kids or any kids that you're working with about their feelings. And one thing we all tend to do, not just parents, we all tend to do as adults is we want to make things better for kids, right? So a kid might say, I feel anxious, and we might say, well, you don't have to feel anxious. I've got this, or I'm taking care of you, or whatever. And that would give the kid a sense of not really being validated their feelings. So I think one key point here is you don't have to try to fix it for your child or the children that you're working with, but you just have to hear them. And at this point, they really need to be heard. The other steps are providing reinsurance that Jenna mentioned, but make sure when you are talking feelings that you validate the feelings that they're feeling. And another thing is encouraging questions. Sometimes when kids don't understand things, right, they keep asking the same question over and over and over again, or they might ask it in a different way. And so just, again, be patient and understand that that's just their way of processing the whole thing.
I think encouraging conversations in general, right? I have a lot of kiddos that internalize things and then make things into something they're not, right? And just having a simple conversation about it can help them a lot with their worries. So
I think there's a lot of uncertainty in times of emergency. So allowing questions, allowing, opportunities to discuss further what's going on, and again, validating those feelings can be a really great way to be able to help support our children, and also to be able to really tend to any anxiety or stress that comes up because of these catastrophes.
okay, I'm going to turn it over to Madison to talk a little bit about how to support those close to you, how to check in with your friends, families, coworkers when tragedy really dominates the news cycle.
Okay, so to talk a little bit more about some strategies that might be helpful. When we want to think about reaching out to the people in our life, right, and reaching out proactively, and things are happening, we want to make sure that we're able to connect with supports, and that might be, professional supports, but it also can be our, supports that we have on a daily basis, like friends and family members and coworkers. So being proactive and starting conversation. It's important to identify and acknowledge what's going on so that we can discuss it and talk about it more and have it be open conversations. And acknowledging the event is important too, so that we're not dismissing the fact that there are big things happening in the world sometimes. And if we neglect them, then more than likely we're probably going to end up internalizing some of those experiences, kind of like Jenna just alluded to with kiddos. It's important to listen more than we talk. A lot of the times we all have a lot of things to say, and they're all valid and important things to be able to express. But a lot of the times the power comes from listening, being an ear to listen for people. It's also important to respect boundaries because everybody copes differently, right? And everybody has different comfort levels and boundaries of what they feel comfortable expressing and talking about and what they might not. So being really respectful and mindful of other people's boundaries within this time is important to protect not only yourself, but also others as well. Offering specific supports, it's important that we're making sure that our needs are met during these times. So whether it's an emotional and mental need, whether it's a basic need, like getting enough to drink, getting enough exercise, getting enough to eat, having time for restful sleep, just making sure we're really meeting those needs with different supports and offering those up to ourselves, but also other people. We a lot of the times talk about kiddos being sponges and they absorb everything around us, but we as adults are sponges too. We definitely are impacted by the things that are going on around us and the people around us. So if we have the opportunity to model different healthy coping strategies, more than likely that might be something somebody else can pick up on, and they might be able to integrate that into their coping and their day each day to manage as well. And of course, resources, right? Reaching out, not being, hesitant to be able to really get the level of support we might need, no matter what that might look like. Again, professionally, within our social groups, even like crisis networks, hotlines, really taking advantage of those resources because they're there to help and support us when we need it.
You're great, Madison. I think we could talk for hours about different coping tools and what can help children and what can help our caregivers. So
absolutely. I'll turn it over to Dr. Stone now to talk a little bit more about how we can support ourselves as individuals.
Yeah, so we're going to get to talk a little bit more about what Jenna just brought up. So you'll also see some of these are kind of intertwined with, some of the things that Madison just talked about and some of the things we've really been talking about throughout the webinar. So first one, overall guidance again from APA and SAMHSA, set limits on media exposure. We just talked about what an impact that can have on you. So one of the best kind of guidance rules is, limit the amount of time, whether you're on social media, whether you're watching the news, whatever you do, but limit that, and don't kind of get caught up in that whole continuous watching the same video over and over and over again or whatever. So set limits for yourself on what you think is appropriate and, that won't add to your stress. Stay informed, but set limits. Avoid extremes. So again, you want to know enough to be aware of what's going on, but you want to avoid doom scrolling, that kind of thing. So find a balance. So balance information with action is another kind of important point here. So there's a lot of this that there's really, we'll look at events that are happening and you'll say, there's nothing I can really do about that. So, I think there are some things we can do, right? So even if it's like within your family or within your workplace, with some of the tips we just talked about with kids or with your coworkers or whatever, there are ways that you can take action to kind of balance all the negative things you're hearing with some positive ways to help other people that are also, kind of experiencing the same thing, right? Another important part is maintaining routines. So basically, the guidance for that would be whatever your routine is, try to maintain it. It's also a good opportunity to improve your routine. We know that when we're under stress, it's really important that we do just basic things, that we eat meals, that we get good sleep, that we do all those things. So even if your normal routine isn't doing that optimally, this is a good time to really hone in on that and make sure you are eating the right amount of meals and make sure you are drinking water and make sure you are getting enough sleep, because those are the things that all of us tend to let go when we start experiencing stressors. Another thing we kind of touched on is practice grounding and self-care, super important. Self-care is anything that really brings you joy in your life and also makes your life less stressful. So really important. Grounding techniques, mindfulness techniques, breathing techniques are all super important. Also, like Madison mentioned, notice your stress signals. So that's what we kind of circle back to those symptoms that we talked about. We're all going to have different stress signals. It's just really important that you kind of hone in and identify what yours are so you can notice when they start to heighten. And last but not least, seek support when needed. It's really important for us to point out that everything that we've talked about is not something that's kind of set aside for a few people. But basically, if you're human, you're probably going to be experiencing a lot of this at some point in your life. So it doesn't single you out in any way except to say that you are a human being experiencing life as we know it and the events of our world today. So encourage anybody to seek support. And along with seeking support, we always say it's better to seek it when you're noticing things just starting rather than when you feel like things have gotten really bad. So let's say you're starting to have trouble sleeping and you're noticing your anxiety going up a little bit. That's the best time to just reach out and seek some support rather than waiting till you're, barely sleeping at all and your anxiety level's really high. So sooner is better when it comes to seeking support. Next slide.
Okay, so some key takeaways. Mental health is crucial to the social and economic recovery of individuals, communities, and countries after catastrophes and emergencies. And despite the adversity that they create, emergencies also offer a little glimmer of hope and offer opportunities to build better mental health systems. We wish that a catastrophe or an emergency didn't have to happen in order for our mental health system to improve, but by leveraging the surge of aid and focused attention for long-term service development, our mental health systems can often get better through these types of situations. Slide. Okay, I'm going to turn it over to Madison to talk more about our community care physicians in-house resources, which is integrated behavioral health.
So integrated behavioral health is a great resource we have within community care here. Integrated behavioral health is outside of community care too. It is a very rapidly developing approach within our healthcare system. When we think about behavioral health, the providers within behavioral health are considered behavioral health consultants. That can be a wide range of providers. They can be like licensed mental health counselors, licensed clinical social workers, psychiatrists, psychologists. So a wide range of providers. One thing that kind of ties us all together is that within behavioral health, we're all working collaboratively with primary care providers to really help support our patients as a whole person, addressing any physical health issues, as well as emotional, behavioral, and mental health concerns as well. We are generalists in the way that we are able to really tend to a wide variety of needs, things like smoking cessation, diabetes management, chronic stress or chronic pain, as well as things like anxiety and depression, goal development, habit management. There's really, the list goes on and on. We could probably spend a whole webinar talking about all the things that we're able to support as behavioral health consultants, but really a big take-home point is that, we are a collaborative support, with primary care providers to really help tend to our patients as a whole person holistically. And we have a really great opportunity to do that here at community care, but also it's, again, a very rapidly developing approach within the world today.
Absolutely. It is. It's huge. And the cool thing about behavioral health consultants is really it's been identified as a new mental health workforce. So it really is probably like the up and coming workforce of the 21st century for really dealing with mental health, behavioral health as a whole person approach that Madison really explained to us. So really brief, in the interest of time, I'm not going to go through all of this, but it's just important to know. A lot of people will say, what's the difference between mental health and behavioral health? So is no difference. Behavioral health is the umbrella, and mental health falls under that. Right. So all mental health disorders, including substance use and addiction, is a big part of this. And then Madison touched on a lot of other things we do: behavioral and adjustments, sleep and fatigue concerns, really just about any life problem aside from mental health and substance use conditions that we will deal with. If you're having stress at work, stress at home, things like that, a behavioral health consultant can help you with that. And it's really a great opportunity for people in kind of any area of life that they're struggling with to get some help when they need it.
Okay, and when the need arises, behavioral health also has some partner options. We've kind of worked to develop partnerships with organizations and providers in the community to offer long-term counseling if needed, treatment for serious and persistent mental illness, and psychiatry for medication management. So they kind of triage through us, and we are able to provide them with linkages to these other areas. Next slide. Hey, any questions?
Yeah, so we're just going to open up the floor for questions. There are some resources towards the end of the webinar, but I think we just want to take any questions that anybody might have right now.
Okay, so far we have one question. What are the signs that say it's time to find a new provider?
That's a great question. I guess our question back to you would be, usually when people are asking that kind of question, they might have some things that they feel like maybe their needs aren't getting met as well as they would like. So I think that's probably one of the things. We can't, I guess the answer is we can't tell you. We can't tell you like 1, 2, 3, 4. This is what you have to look for if you need to find a new provider. But I think one of the main things is the provider should, you want somebody that's going to be meeting your needs or addressing what you want to have addressed. Or, usually there's, and I don't want to speak for you, but usually there's some level of kind of questioning that when you're asking that question. So I think I definitely encourage my peers to answer, but I think probably we would generally turn it back to you and just ask, well, what do you think you're missing? What do you think, what do you think, I guess, you would like to see? And if you have a lot of kind of answers to those questions, then that might kind of lead you to finding somebody that you feel might be a better fit. I guess I would also encourage you too to have that conversation with the provider that you're seeing, because a lot of times maybe that provider might not be aware that you have those needs. So, I think it's kind of a bigger question. I hope some of those things kind of help, but it is a big question, and there's no kind of one size cookie cutter answer for that.
I agree. I think we as providers always want our patients to come to us with any concerns or questions, or, hey, this isn't working for me, or this is what I would like to see more of. I think I can speak for most of us that that's kind of what we would like, because we just want to figure out how to best support you as an individual.
Yeah. So talking to your provider about it for sure. If you've already done that and things don't seem to be changing, then probably some more inward thinking and making a directional change possibly at that point.
Okay, we have someone who's asking if you need to be a member at Community Care to get help.
So we work within community care. You don't need to be a member to get mental health treatment. You need to be a member of community care to receive integrated behavioral health services from us, though. Yes. But there are lots of resources available. So when these slides are posted on Community Care's website, you'll see all of our resources towards the end. There's lots of resources in our community that you can reach out to as well.
Yeah, and we also encourage you, if you're not a member of Community Care and you're struggling getting access to mental health services, reach out to us. We'll certainly help you get connected.
Right this minute, do you want to go on to the additional resources, and then we can check back and see if any other?
Yeah, we can just display them. I don't think we really have to. We can kind of just overview them really quick. So this is a really great 2 helplines to be focused on. I think we're all aware of the 988. That's for crisis, but it's not just for crisis. It's for anything that you happen to be struggling with. There's also a specific hotline developed just for disaster distress. So anything related to anything that we've talked about today, this is a hotline that is all the time available to you that will discuss whatever kind of emotional distress or any kind of anything you're experiencing as a result of disasters. Okay, so I think one of the biggest things for these is just sometimes people think they have to be in crisis or they have to be, they're reserved about when to call. So you can text or call at any time.
I think that's one of the biggest things to keep in mind is that those resources are always available. They're 24 hours a day, 7 days a week, so that there's always a support out there for you in any time of need, no matter what time of the day or no matter what's going on. So you always have some type of support available to you.
And you don't have to be in crisis. If you just really have the need to talk to somebody, call or text. Okay, this is just kind of like an overview of mental health in emergencies. So kind of like this great little diagram of kind of how to navigate this before, during, and after. And so these resources are going to be made available for you. So I would, a lot of people will be like, oh, it's not going to happen to me, or this seems like a big deal, but just glance through it. It's really good guidance. It's from the CDC. And this is just kind of a graphic of what we've talked about with vicarious trauma. Again, for your resources, it kind of diagrams out a lot of what we talked about. So feel free to review that on your own time.
We did note at the end here that if you think of any additional questions that you didn't ask today for Dr. Stone, Madison, or Jenna, please email marketing@communitycare.com and we will send your questions to them and they would be happy to get back to you. And thank you everyone for joining us.
Yeah, we really appreciate it. It was great spending time with you today.
Thank you.
Thank you so much. Bye.